Okay, so now we are starting our last point of this topic number 6. So it is the biopharmaceutics. So the syllabus points are the concept, definition, introduction to biopharmaceutics, that is pharmacodynamics, and clinical pharmacokinetics. So all these words are related with the pharmacology, that is how the drug is used and what is its effect. So what is firstly means the pharmacodynamics. So what is a drug does to the body? So it is the study of mechanism by which the drug produces a response. It is called as the generally pharmacology. Then what is stimulation? So drug, what are the actions of the drug? So stimulation, so it is enhancement of the activity of the special part. For example, adrenaline stimulate, so it is part of the nervous system. Then inhibition, depression, so selective diminution of the specialized cells. We are knowing the depressed heart is there, or functioning of the heart. Then replacement, so it refers to the use of natural metabolites, that is hormones deficiency. For example, iron used in the anemia, that is the weakness in digestion, or the generally having the causing the weakness. Then irritation, so it is often noxious effect, and particularly due to eating the wrong food. For example, counter irritants are there, suppose the blood flow or the causing the irritation of the skin is there. And then what is pharmacodynamics? So it is the relationship between the drug concentration at the site of action and resulting the effect, and which includes the time course and the intensity of the therapeutic and adverse effect. Already we are knowing the what is the relationship between the drug and the disease, right? So it is showing the either positive effect or the adverse effect. The effect of a drug present at the site of action determined by the drug binding. So already we are knowing, suppose we are going to the doctors and suppose any wound is there, so this drug generally acting on this part only, either it is an injection or either it is a tablet. So it goes to the heart and then it is supplied to the part, right? So this is the one. Then in drug action there are the main four biomacromolecules are the targets. For example, enzyme, then ion channel, membrane bound transporter, and the receptor. So here the photograph is given of this. So how our drug is related with this one. So just we have to understand this. So it is only for understanding, you have to not draw the any diagram or this one. So there is a channel is there, just you see how it goes to the tissues or how it goes to the part is there. Suppose enzyme action is there, so it is separated through the channel, it is from the transporter and it is to the receptor. So where the any wound is there or any part is there. Then factors affecting drug response are the density, then mechanism of transmission, then regulation factors are there. So here suppose the any cell signal is there, receptor is there, so, or the regulation of protein production is there. So drug and the receptor, these are important. So we are knowing that how some people will not require the these generally proteins, or some are generally having the they require the certain drugs are there. So right. Then factors affecting in this drug response, there are the some graphically it is shown. So dose response is there, so how much dose in milligrams. Suppose the threshold is there, individual response, so dose that produces just a noticeable effect. Then it is lowest one, you see the graph, threshold is there, then ED50 and the ceiling is there. ED50, that is the it produces a 50% response, and ceiling means it shows the lowest dose that produces a maximum effect. So dose, how much dose is there? Nowadays we are knowing the corona, so corona vaccine is there, so it is 5 ml dose, but it effect slowly on the body. So these are the certain dose response curves are there. So what is therapy? Therapy, that is the act of use of medicine. You remember the meaning. Therapy means the act of use of medicine is there. So just we have to know about this character. Then there are the outlines of the clinical pharmacokinetics are there. Our second point is there. So in pharmacokinetics, absorption of drug, distribution, metabolism, and the elimination of drug. So they are related with this certain principle. So it is defined as the pharmacokinetics. It involves the study of absorption, distribution, metabolism, that is biotransformation, and the drug excretion over the time. So refer on the how the body act on the drug. So what is the response of the body, and it is called as chronoids. And then what is clinical pharmacokinetics? So it is the application of pharmacokinetic principles to the safe and effective therapeutic management of the drug in an individual patient. So any patient, any injection is given, suppose. So what is the application to the body? And it is called as the clinical, right? So it is in our syllabus. Then in pharmacokinetics, the body does to the drug, and this absorption, distribution, metabolism, and excretion, ADME, of the drug is there. So you are observing here, suppose the injection is there, how will that stuff and get down generally either in animals or the humans are there. Absorption means generally how the drug is moved into the bloodstream from the site of administration. Suppose we are taking in the hands, we are taking in the back side, right? Or so therefore how it's absorption. Then distribution, how much drug is moved to various body tissues or organs depend on the blood flow through the tissues. And metabolism means how the drug is altered or broken down. Excretion means how much of the drug is removed from the body. So these 4 points are very important in pharmacokinetics: absorption, distribution, metabolism, and excretion. So you remember this. In pharmacokinetics already we have seen this definition. Then there should be having the adequate drug doses are the important. Either these are therapeutic and the non-toxic levels are there. Then suppose there is a too much drug will result into the toxic effect, and too little will not showing the result. So therefore it is also important. It cannot be acting as a poisonous, or it will be having as per the desired or the wanted action or the effect is there. Then there are the certain narrow certain medications are there, uses of the drugs are there. So this shows the applied through the administration routes, either oral or either we are taking the tablets, right? We are taking the injection. So therefore in pharmacokinetics generally the application of pharmacokinetics principle to be the safe and the effective, right? Then it shows the efficiency of the decreasing toxicity to the patient. Then plasma drug concentration are affected by the rate. Plasma means the blood, right? Nowadays you are listening in corona condition, plasma donors are there, so antibodies develop, so their blood is given in small amount to the patient, and therefore it is going to multiply. Then nextly there are the linear or non-linear pharmacokinetics. So you are observing the graph, so it shows the straight, right? So when does not increase, it does the increase the most drug steady state or concentration. So it's showing the, and linear means concentration changes in a disproportionate fashion after the dose is altered. So this drug is called as a non-linear, and linear means it is having in the proportion, right? So the steady state and the linear state, these are the important, and therefore saturable plasma protein, that is the blood protein, it should be the it is important, and it is called as the auto indication, right? So auto indication is the important part, so you remember this word also. In pharmacokinetics, here you are observing the one componental model before administration and the after. So the basic type of model, generally it is considered that it shows the one compartment, two compartment, and multi compartment models are there. So here the two models, the one compartment model, linear assumption, the drug in question is evenly distributed throughout the body into a single compartment, and the model is two, only apart for the drug which rapidly and radially distributed over the plasma through the blood. Then drug which exhibit a slow equilibration and peripheral tissues, best described with this model. So two compartments are there immediately after administration, after distribution of equilibrium, and before the distribution. So by photograph you can understand. So what is the model condition is there. Then absorption of drug. So in absorption, this drug generally distribution, metabolism, inhibition, and first one is the absorption. So already we have seen this mechanism. Here the absorption means the movement of drug from the site of the administration, and occurs the dissolution of the solid into the liquid. Suppose we are taking the tablets, so they are firstly going into stomach, that in the later on they dissolve, and they get involved into the blood circulation. Then these four mechanism takes place, drug molecules. So passive diffusion, facilitated diffusion, active transport, and bulk transport. We are eating these tablets. So here they show the effect of the drug on the body as therapeutic, then local and systematic effect, and the adverse effects, side effects, and the other effects are. What is therapeutic? So it is generally effect are the medication or desired effect as per our wish. Then length of time and the client or the patient, how it receives. Then adverse effect means generally there is effect other than the therapeutic effect, and therefore, for example, PCM, liver toxicity. So drug is given, it may causes to the liver, or suppose side effects are there are minor side effects, for example nausea or the vomiting is there. Then nextly there is a local systematic effect is there. So various parts of the body they absorb, and there may be effect. Suppose the skin or the mucous irritation is there, it is called as a local. Then allergic effects are there. Allergy means the client or the body patient, generally it shows the allergy. So if particular urinary systems effect on this one. Then effect on CVS, that is the effect on the central nervous system is there. So it may cause headache or dizzying or insomnia, right? Hypertension, hypotension, low blood pressure, high blood pressure, like this one. So it is called as effect. Then effects on GI, that is the it may causes the mucosal irritation, constipation, diarrhea, right? General effects are there. So in combination of two drugs, suppose two drugs are given and it shows the effect of both. So suppose there are different types are there. So pharmacokinetics, then molecular pharmacology, effect on DNA or RNA, toxicology, effect, harmful effect of the due to drugs. Then chemical names are there. Nowadays different companies are there, their proportion is different. Then second part is there, our pharmacodynamics. So it is the study what the drug does to the body. Already we have seen on firstly. So here the suppose the relief in the minutes, and therefore this pharmacodynamics, it is also important. It shows the different factors, the dose and the route, duration of treatment, time of administration, drug interaction, then age, weight, diet, and the tolerance of the patient. It is related all this one. So this is the one part. Then these adverse drug reactions are there. So either there are some adverse effects or the adverse side effects, toxicity, allergic, physical dependence, and the carcinogenic, that is the toxic one. And lastly, the different forms of the drugs, either solid, liquid, or semi-solids are there. We are knowing these drug types are there. And here the solid doses are the powders, granules, tablets, others are lozenges are there. Then semi-solid, there are the jellies are there, paste are there, right? Creams are there. Others liquid drugs already we are knowing. There are the syrups are there, then lotions are there, right? So solutions are there, or the sterile some doses are there, so they are to be used. The liquid forms and the solid forms we are observing here. So these different tablets, pills, capsules, lozenges, suppository are there. In liquid, syrups, drops, suspension are there, tinctures are there, emulsions are there. So by photograph you will be observed. So these different types of the drugs and their actions are there. These are the analgesic, which causes the anesthesia or the senseless. Then mild analgesia, then norcutic which they tolerate the condition. Then prostate glands, like hormones or the substances are there, or some anti-inflammatory drugs are there. So points are very simple. Pharmacodynamics, then pharmacokinetics are there, right? So this is our last point of this lecture. In the next lecture we will start the last topic number 7, ethnobotany. Okay, so thanks to all.